Hi, I'm Jamie Kelly. I'm a upper GI surgeon at Southampton University Teaching Hospital. I'm the upper GI lead there. I also am a bariatric surgeon, principally out of the Spire Southampton, working for Healthier Weight. And I'm also an interventional endoscopist in the NHS and privately. And that's where I do my endoscopic bariatric weight loss surgery. I work with Healthier Weight, and I have done for 10 years, I think now, or more actually. And one of the reasons I started working with Healthier Weight was the way that David set the company up. It ensured that there was adequate follow-up, and that's really important for sort of outcome in terms of bariatric surgery. And then that's been taken into the future. There's really good phone contact, nursing contact, medical contact and psychological support if needed post-operatively. And you know, if I felt that wasn't there, then I wouldn't be involved, but it is, and the Healthier Weight look after their patients post-operatively. We have a huge population and everybody's different, and as a consequence, you know, you don't buy the same shirt as I do, and so the patients will want different things, and we have to accommodate for their needs. And so a patient will want a balloon, then a patient will come to see me and they want specifically the ESG, or they will have had a previous bariatric operation and they'll need some thought around what revisional options they've got available to them. So it's really important to offer the whole range of surgery, whether it's the first time, second time, or even third. Southampton Spire is a really impressive private hospital. It's literally next door to the Teaching University Hospital, so you've got instant access and cross-fertilisation between the two. I do a lot of my cancer resectional work there, and I'm happy. It's a different private hospital because it has a huge intensive care unit, and that facilitates our NHS practice as well, so that we can take on challenging cases. And it's a really safe, secure environment. And I have to put the ward up there as well, because the ward that we use is excellent, and they really know what they're doing, and they look after the bariatric patients really well. So it's a very good hospital, and the theatre staff actually they're really comfortable with the surgery as well after many years. You know, and that we know that, again, if you look at the research around that, if the environment is, if the surgeon is very comfortable with their environment, it actually starts to reduce complication rates as well. We at Southampton, we put all of our patients into the National Bariatric Database, so we've got comparative data to the rest of the UK, and we know we perform well. The decision has to be driven by the patient. The commitment to success has to come from the patient. I can give the patient something to use, but if they don't use it, it won't work. The analogy I will often use with the patients is that if I give you a brand new car, you can go off and drive that, look after it, get it serviced, get the tyres changed. It'll last for hundreds of thousands of miles. But if you take it around the corner, joyride it into a brick wall, it's not going to work. And it's the same with bariatric surgery. If you use it well in conjunction with dietary change and exercise, the results can be astonishing and life-changing. And that is a joy to see. There's lots and lots of stories of people being successful, and patients are so kind when they write back to you and say how they've got on, and it's how they've changed their life. If they've had a child, which is one of the other reasons people come to see us, to get the weight loss to help with pregnancy. One of the recent ones I remember, I won't mention his name because it's not appropriate, but he had been in the armed forces for some time. He'd been injured quite badly back in the 70s, but continued on active service. But his weight was getting problematic, and it was really limiting him, and he's put in a huge amount to this country, for this country. We got his weight back down again, and he is up mobile and enjoying life and enjoying his job and looking forward to retirement, which is lovely. The vast majority of patients come back to me and say, why didn't I do it sooner? Because of the improvement in their quality of life. The other thing is always to think about is if you're developing illnesses associated with your weight, you don't want to get to the point where you've damaged your organs, where you can't bring them back, and so your health is going to be damaged permanently. There's a horrible statistic that when patients hear it, it can focus their mind, in that once patients' BMI goes 50 or above, their life expectancy goes down to less than 10 years. So, I mean, that's a staggering and scary statistic. There's also the building body of evidence with obesity and cancer. And so, again, if your weight is increasing, you're putting yourself at risk from developing cancer and again, foreshortening your life. But there's the other aspect of bariatrics, in that a lot of, particularly women perhaps, they will have sacrificed themselves for family for quite some time, and their kids and everything else, and they've put everybody else first. And if they then come and they have the operation and they lose the weight, all of a sudden what they describe is, they say that we're included in the family again, because they can go out and play with the kids, they can go to the park and run around on the slides, even to the simple thing of they're not embarrassed to go on holiday because they can fit in the plane seat, and it's tiny little things. They can go into a shop and buy normal clothes off the peg, and that just makes a huge difference to them, and it gives them their confidence back after sort of being buried with kids for a while.